बिस्मिल्लाहिर्रहमानिर्रहीम इय्याका नअबुदु व इय्याका नस्तईन अल्लाहुम्मा सल्लि अला मुहम्मदिन व अला आलि मुहम्मदिन व बारिक सल्लिम व सल्लिम अलैहि। Dear colleagues, I am Dr. Sultan Ayub, working as a radiologist. This is a male patient, almost 40 year age, with history of intense pain for the last 2 days in the left testes. So I am going to scan the scrotal region. This is right testis. And this is the left testis. So look at the ecotexture of the right testis, which is normal, and look at the ecotexture of left testis, which is abnormal, and this patient is also complaint of acute left testicular pain that is very intense. So it is relatively heterogeneous hypoechoic when compared with the right testes. And here we can appreciate the skin, thickening of the skin on the right testes and thickening of the skin on the left testes. So this is the scrotal thickening. So scrotal thickening on the left side is increased, and also when we observe the scrotal sac, we can appreciate the fluid hydrocele within the left scrotal sac. So three findings are present in the left testes, left scrotal region. Number one, increased scrotal thickening, hydrocele, and heterogeneous relatively hypoechoic ecotexture of the left testes. So now I am focusing the left testes as the pathology is in the left testes. So when we observe the pathology or the abnormality in the left testes, we should then put the color. So look at the blood flow within the left testes. Now this is the right testis, which is normal. Look at the vascularity. And this is the abnormal left testis. Look at the vascularity. Here the vascularity is greatly increased, while it is normal one in the right testis. So we have seen 4 points So we have seen the 4 findings in the left testes. Number 1, increase scrotal thickening. Number 2, hydrocele. Number 3, heterogeneous relatively hypoechoic left testes. And then 4th one is the increased vascularity. So all these lead to the orchitis, and this is the reactive hydrocele due to the orchitis, mean inflammation of the testes. When we observe the orchitis, then we should also focus on the epididymis. So I am going to scan the epididymis. Look here, this is the hydrocele, this is the left testis, here is the lower pole of the testes, and this is the upper pole of testes, and this is the epididymal head. And here we can appreciate another structure which is hypoechoic, also heterogeneous, and it is attached to the upper pole of the right testes, very close or abutting the left epididymal head. This is the wall of this hypoechoic structure, heterogeneous, and this is the appendix of the left testis. It is usually present in the almost 70-80% of the male, and also it is attached to the upper pole of the testes. Normally very difficult to see it. Can be seen, I don't say this cannot be seen, so very difficult. However, when there is some pathology in the appendix of the testes, this appendix then increases in size and then it changes its ecotexture. And also when there is a pathology, it causes the intense pain. So then again I have already focused the left testes. Now I am focusing the appendix and epididymal. What is the appendix? Appendix also present abdomen, and this is the appendix of testes, which is the remnants of the paramesonephric duct. It is the Mullerian duct we have already studied in the embryology. So it is the remnant, vestigial remnant of the paramesonephric duct, Mullerian paramesonephric duct. So it is the remnant. Sometimes it can go under the torsion. So now I am again looking at the vascularity of the appendix. Here we can appreciate the vascularity within the appendix. So it means that this is the increased vascularity. Otherwise the vascularity is hardly visible. So it means, so two pathology we can appreciate when the appendix is visualized and the size is increased. Number one, the infarction. Appendicular infarction is also, the infarction of the appendix or testis is also present. And number two is the inflammation of the appendix. Normally the size is less than 5 and the oval in shape, and its echogenicity is close to the adjacent testes. But here we have seen the testes is also abnormal. This so we can't correlate it with the left testes. However, when we consider the right testes, its echogenicity is decreased and it is heterogeneous. Also the vascularity is also increased, which we have seen. So when we measure the size, it should be less than 5 or around about 5. It is 6.1, mean more than 6. So we can say that this is enlarged, heterogeneous in ecotexture, showing the vascularity which is increased. So along with the orchitis, the inflammation of the appendix is also present. So now I am focusing the right epididymal head and also this is the body, and I am going to see the tail. So relatively increased vascularity is present, but it is less than the left testis. So we can say that orchitis and inflammation of appendix is present while there is developing inflammation of left epididymis. So epididymitis is also developing. The history is of 2 days, so uh, this fellow may have also epididymitis. So we can say that this patient will go into the epididymoorchitis and also the inflammation of appendix. Also now we see the vascularity of the arterial waveform. Okay, what is the velocity and peak systolic and end systolic, and then flow. So we can appreciate that again we can see the so here the diastolic component is more than we observe in the routine practice. Again and look at the mosaic pattern of the here we can appreciate this is the intratesticular vessels. So we can appreciate here this artery is having almost more than 30 millimeter peak systolic velocity, and look at the diastolic component, it is also very much increased up to almost 22. So we can say that during the orchitis the vascularity is greatly increased, and then also the peak systolic velocity and diastolic velocity, and then these are also increased, while this is not seen in the routine practice. So this was also about the intraparenchymal vessels, arteries, Doppler study of the intraparenchymal vessels. So this was all about this case. Actually, we have already discussed about the epididymoorchitis. This was a new thing, the appendix of the testes, which we rarely come across. So then I like to share you people about this new thing also. The appendix of the testes is also inflamed along with the epididymoorchitis. Thank you very much.